Welcome. This is a tour of the WIC medical documentation form for WIC formula and approved WIC foods for women, infants, and children. This is the prescription form that our partner physicians and nurses will fill out for some WIC foods and formulas. Standard contract formula does not require a prescription because it is suitable for wider audiences. Specialty formulas and specific food requests are only appropriate for women, infants, and children with relevant and specific medical needs. Use this form to request specialty formulas, WIC-eligible nutritionals, standard formulas for infants unable to tolerate solid foods, and supplemental foods for patients with qualifying medical conditions. Please fill this form out completely and appropriately to ensure that your patient receives the appropriate prescription. You can also find all of these instructions on the back of the medical documentation form. The form is divided into 6 sections. Please fully fill out the medical documentation form. If you have any questions, please call WIC directly at 716-218-1484. Section A, located here, is where you will fill out the patient's name and date of birth. Section B, Formula. This section contains information about the formula you are prescribing. Please fill out this section completely. Line 1. Formula nutritional requested. This is where you will put the name of the prescribed formula. Use the link in the video description below to find the formulas that are covered by WIC. If a patient needs more than one type of formula or could use some guidance finding products in the store, you can write down multiple formulas on this list. Line 2. Product form. On this line, you'll need to specify whether you're selecting powdered or concentrate formula. If neither option fits your needs, choose Other and indicate whether you prefer ready-to-feed or ready-to-use formula. Remember, if you've entered multiple formulas in the section above, they all need to be in the same form. Line 3. Prescribed amount. This line is where you'll need to specify the prescribed amount of formula per day. WIC allows for a maximum of 20 to 32 ounces per day. It's important to note that ranges, maximum amounts, or ad lib, as desired, are not acceptable. Line 4. Length of use. This is where you will indicate how long the individual will be needing the formula. If the formula is for infants, you'll need to specify the number of months they'll be using it, or you can simply check until age 1. For women and children, indicate the number of months for which the prescription is valid, or a maximum of 12 months. It's important to remember that a new prescription is required for every certification period. Line 5. Special instructions. On the special instructions line, you can include any relevant information regarding medical conditions, allergies, formula history, or any other details that may be important for the individual's healthcare needs. Line 6. WIC, qualifying medical conditions. On this line, please select one or more of the qualifying medical conditions. If the diagnosis is not listed, you can select Other and specify the medical diagnosis. The following non-specific symptoms and conditions are not acceptable: dermatitis, formula food intolerance, fussiness, gas, spitting up, constipation, diarrhea, vomiting, colic, underweight, or overweight. Let's move on to Section C, WIC supplemental food restrictions. If this section is left blank, WIC nutrition staff will assess whether WIC supplemental foods should be issued based on the individual's needs. Checking Not Allowed is only permitted if the patient cannot tolerate any of the items listed. For infants aged 6 to 11 months, WIC will provide higher amounts of formula to those who cannot tolerate solid foods. For children over 12 months and women, WIC will provide infant foods, such as infant cereal and infant fruits and vegetables, to those who cannot tolerate regular solid foods. Section D. Prescribing healthcare provider information. This section must be completed entirely by someone with prescription privileges. It's important to note that forms containing information from other office staff will not be accepted. Section E. Participant release of information. This section should be filled out by the patient. This signature is very important as it gives us permission to talk about the feeding needs of the individual with our team. Section F. WIC staff use only. This section is designated for WIC staff to use after reviewing the completed form. We appreciate your cooperation and thank you for assisting us in serving our families.